Hello. Can everyone see and hear me? Great, great. Hi, everyone. My name is Jean Bucaria, and I am the Now New York Vice President. And I'm really excited to be launching into this important discussion today on reproductive justice and rights. And I'm excited to also be joined by two women who are absolutely key in defending reproductive rights and advancing reproductive justice. First, we have Elisabeth Estrada. She is the New York Field and Advocacy Manager at the National Latina Institute for Reproductive Justice. She engages in movement building for reproductive justice, builds relationships with community leaders, partners, and elected officials, and develops campaigns throughout New York State. And she also serves on the board of directors for Sister Song. So welcome today. And also joining us, we have Elisabeth Smith. She is attorney and the chief counsel of state policy and advocacy at the Center for Reproductive Rights. This is the organization that you all know well, argued the June medical services case before the Supreme Court earlier this year, and is at the forefront of legal action for reproductive rights in the US. So thank you both for joining me today. So I want to start with something that we often don't get to start with when we have conversations on this issue. I'd like to start with some good news. We have just elected a pro-choice president and the first Black woman, and first South Asian woman to be the Vice President of the United States. And we know as a senator that Kamala Harris was a champion for legislation to support abortion access, also helping with Black women's maternal health. She's been a real champion. So I want to put this question, we could start with you, Elisabeth Estrada, and then go to Elisabeth Smith, but what can we expect from this Biden-Harris administration?
Well, just like you said, the first Black woman vice president in the history of the United States has also publicly stated that she would end HIDE. So I think that is a really great moment. We're in the moment. We need it. It's great to have an elected official at the highest position in the United States say that, and we hope to push them along and hold them accountable and keep them to that word. So I hope that that's what I'm looking forward to.
Yeah, absolutely. And as we know, I think it's interesting to note that early on in Biden's campaign, he did not come out explicitly against the Hyde Amendment, which, as we know, prevents women who need Medicaid coverage for abortion to be able to afford that care. And it was because of the pressure of organizations and advocates that he really had to turn that around. And so I think it's important that we keep that pressure on. Elisabeth Smith, what about you? What might be some positives that you're looking forward to?
Yeah, and I think this is a great way to start. I also want to say I'm so happy to be in this conversation with the two of you today. First, I think with a Biden-Harris administration, there is a lot more support for federal legislation that would safeguard reproductive health and rights. And I will just mention one of those. My organization, the Center for Reproductive Rights, along with lots of other partners, has been supporting the Women's Health Protection Act for several years. And that's a federal bill that, if enacted, would create essentially a floor and would stop states from, passing the restrictive bans and bills that they are passing now. So it would essentially say, no states, you can't pass gestational bans. No states, you can't require providers to give biased counseling before they provide abortion care to their patients. And there are lots of other federal bills that in this administration we could also see move. But I think I'll pass it back to Elisabeth to maybe mention some of those that her organization is working on.
Thanks, Elisabeth. And it's nice to join you too. I always love doing panels with attorneys. We complement each other well. I think that, the policies that Elisabeth mentioned are excellent, and, we certainly support that. I think that for immigrants, which is the community I serve, we are still looking for policies that would, kind of support all of the people living in the United States. So as a national organization, I'm working in New York, we are supporting the Heal for Immigrants Families Act. And that would basically remove the 5-year ban on accessing, public care, health care, Medicaid, Medicare for folks who are just arriving here. And for the community that I serve, it's been quite difficult to really get behind any one particular candidate, if you will, because it goes beyond party in just saying everyone deserves healthcare. Everyone deserves to be able to go to and get, a regular pap smear and not have to decide between having that or paying rent, or having that or, paying for your kids' meals. So HEAL has been something that our community has really connected to, simply because we all have, if say we are first generation here and we all have our documents and our, documented folks, we have mixed status families. So often we look to our, grandmothers and our aunts and our mothers to be also protected in that. It's not just about children, because we have mixed status families. And so HEAL has been super connected to our communities. And of course, each, lifting the Hyde Amendment. Henry Hyde back in the 70s specifically stated that he wished he could end abortion for everyone in the United States, but his only avenue was the Medicaid program. And so we hope to see that lifted and hope to open up the access to folks that are low income and couldn't otherwise pay for their own abortion and are forced to make, or rather taken their autonomy away. So that's, hopefully we're in that direction.
Yeah, and that's just so people hear that, that's the Each Woman Act, which is the Equal Access to Abortion Coverage and Insurance Act. That's a federal piece of legislation. And I think what you're talking about, it's so key. I think it can be hard to understand why, as a baseline, we can't accept that healthcare is a human right. And I think that we saw this in particular with COVID. It's something we saw the ways in which when we leave the most vulnerable and marginalized, or the people without access to healthcare, when we have that, everyone suffers as a result of that. And that interconnectedness has really played out. And so I hope that we see that more than ever, that it just doesn't make sense for anyone to not be able to provide healthcare for all people and make that comprehensive. I know that, one of the reasons we really want to have this discussion today is because, of course, at the foremost of our minds is, Trump may be out, but Amy Coney Barrett is here to stay, unfortunately. And Trump had 3 appointments to the Supreme Court: Gorsuch, Kavanaugh, and now Coney Barrett. We're facing a 6-3 anti-choice majority. I know Elisabeth Smith, this is something that the Center for Reproductive Rights has been working on for years. You've had an ongoing report on what if Roe fell. And I think we're all on high alert and want to understand in this moment what we can expect. So maybe you could speak a little bit to what's in the pipeline.
Absolutely. So I bet that most people who've tuned in for this conversation know that, for the last decade and beyond, even before that, states have been passing abortion bans and restrictions at an ever escalating rate. And so many of those litigation on many of those unconstitutional bans and restrictions is working its way through the federal court pipeline. And as you said in my introduction, the Supreme Court heard June medical services this summer. And that was a case out of Louisiana. Louisiana passed a law that was identical to the Texas law that was meant to shut down clinics. That was the subject of Whole Women's Health versus Hellerstedt in 2016. And what we saw this summer is that there were 4 justices who wanted to uphold Whole Women's Health and say, states cannot do this. They can't pass restrictions with no evidence. And we saw Chief Justice Roberts vote with the 4 liberal members of the court, but he said something different. He essentially said, Whole Women's Health controls. Yes, Louisiana was trying to do the same thing as Texas, but going forward, I would apply the test from Whole Women's Health differently. So that concurrence that Justice Roberts wrote was a signal to lots of anti-abortion politicians in the states to continue to pass these bans and restrictions and to send that litigation to the Supreme Court. And now we see a court with a 6-3 majority against abortion rights. And that's, this is the first time we've had a court this opposed to abortion. since Roe was decided. And so there are lots of different challenges to abortion bans and restrictions making their way to the court. At the court right now is a 15-week ban from the state of Mississippi. 15 weeks is absolutely before viability. And what Roe v. Wade said is that prior to viability, pregnant people have the right to decide whether to continue their pregnancy or not. And so with this majority on the court, there is absolutely a concern that the federal right to abortion could be in some way upended or restricted or potentially overturned. I do want to say, though, for everyone listening, it's highly unlikely that we're going to get a decision from the court in the future that says Roe v. Wade has been overturned, because they know that in doing that, the 70% of Americans who support abortion rights would be galvanized. So instead, what we're likely to see at the court is just more kind of cutting back on the right, more leeway to states to pass restrictions and bans. And I think what that means is that we'll continue to see this patchwork of access in the states. You know, in New York, we're in a very different context than, say, my home state of Texas, for example. And so we will continue to see these challenges get to the court. But I think we are also seeing, we are really in a moment where people are speaking up about their support for reproductive rights and for abortion rights. So I don't want to, we are in a difficult moment, and we can't ignore that. But I think we also have to look at all of the advocacy happening at the federal level and this in the states, and really uplift and support that work and the conversations that are happening.
Yeah, and Elisabeth Smith, one of the things that we had talked about that I think you might want to just bring out for our participants today is there are a lot of states that have these quote unquote trigger laws. And I think when we get a decision at the Supreme Court level on Roe, what will happen? Will these trigger laws go into effect in a way that just completely obliterates access at that moment? What can we expect?
Thank you, Jean, for that reminder. Yes, so there are 10 states in the country that have so-called trigger bans. And trigger bans are, I would describe them as another sort of fever dream of anti-abortion extremists. These bans are meant to immediately prohibit abortion if the Supreme Court was to overturn Roe, or if the Supreme Court was to allow states to have the final say on whether abortion could be legal. I want to caution everybody listening to this conversation, though, and say, you know, the 10 trigger bans that have been passed are not in effect. And so no state has ever tried to actually implement one of these bans. And so when we talk about trigger bans or other bans and restrictions, we always have to be vigilant to not give our opponents too much credit, right? And so I've been trying to say every chance I can, you know, we know what trigger bans are meant to do. We don't actually know that they will be successful. And again, because each trigger ban has a procedure for implementation written into it, there will very likely be litigation if a state tries to say, okay, we now have the right, we can ban abortion completely in our state. And I'll just highlight, the center has a resource called What If Roe Fell on our website. And so if you're interested to see which are the 10 states that have a trigger ban, if you go to the What If Roe Fell resource on reprorights.org, you can actually sort and see a map that will highlight all of the states with a trigger ban.
And that really gets to another point I want to bring up that we'll get more into our conversation. But you know, it's about ceding ground in the conversation. Like if we just throw up our hands and are saying trigger bans go into effect, it's gone. Let's not cede that conversation. You know, let's talk about you know, there have been wins, as you mentioned. You know, 7 in 10, poll after poll shows that a strong majority of Americans do not support the overturn of Roe v. Wade. And so, how do we get that message out? I wanted to ask you, Elisabeth Estrada, a little bit more about the work you're doing to do this, because we know already we know already nearly 90% of counties across the US don't have an abortion provider in that county. Many have to travel 100 miles or more to access an abortion. There are 6 states that only have 1 clinic. And you already touched on, Elisabeth Estrada, you touched on, you know, this patchwork that's happening because of Hyde being in place. So what has been the strategy of your organization, in particular, reaching Latinx and Latina women?
Thank you for that question, because I often hear a lot of our activists and base say that they may have the right on paper to access abortion, but the access is not necessarily there. So how you were saying with the clinics, and especially when you look at states like Texas, which we've had a presence in for over a decade now, access to that right is not there. They've closed tons of clinics there. Even in a place as liberal as New York, we have more crisis pregnancy centers or fake clinics than we do actual abortion clinics or women's health clinics. And when you think about those inequities, they're especially striking among reproductive age women with low incomes or below the federal poverty level, in which you see immigrants overrepresented, where non-citizen immigrant women are 3 times as likely to be uninsured as US born, and about half likely to have Medicaid coverage. So when you think about that, it's as if the right to an abortion is not necessarily there in intangible, because if you have to go to another state, you have to pay for a hotel, you have to pay for a flight, you have to pay for gas or rent a car or have someone take you. And so all of those stories may seem anecdotal, but are the things that are shared within our groups. They're the focus of our, what we call cafecitos, where we sit down with a cup of coffee and our community to talk about issues that would otherwise be, hush hush, or you could be judged. So we open up doors for education, for hearing, for centering most impacted voices. And that, I think, makes people feel less small. When you think that these inequalities are happening to just you stay quiet. It brings out shame even. And so what our place in the movement is, and has always been, is really to say that our stories matter, our issues matter, they impact us in a different way, and we may see a different face on the, like on the news or in the media, but it doesn't mean that it isn't our fight. And so a lot of that is consciousness raising. It's about talking about the impact that Latinas and people of color have had made to movements, to the reproductive health rights and justice movement, so that they can see themselves represented and they feel that they have a stake in this claim towards, really at the end of everything, is the liberation of us all. Because if we cannot make decisions about our bodies, then we aren't free. And if we aren't free, then we don't raise our voice and we go back in hibernation and we think that all these things are our fault. And that is really at the center of what this consciousness raising is. It's not that you're making bad decisions and that you're not a go-getter. It's rather that this system is put in place to create a division. And that is really illuminating for folks. It makes people feel less alone. And that, to me, is at the center of organizing and grassroots organizing and having conversations and complementing policy with the people that need to go and testify at a, Whole Women's Health or at SCOTUS, where we've had, some of our folks go all the way to the Supreme Court to support these cases so that they can just say, we just want clinics in our neighborhoods. We just want access in our neighborhoods. And we want politicians out of our, private decision making. And what we hope to do is empower those voices and say, that's valid. That's not only valid, but it's strong and powerful. And we want to help you, fill in the education gaps that you maybe didn't have before, so that you can feel more comfortable raising your voice.
Mm-hmm, mm-hmm. And I think that's so important too, because, just to hand this over again to Elisabeth Smith, that you mentioned, even though there's this majority that supports abortion rights, it often doesn't feel like that in our communities, because there remains this stigma, and there remains a hesitancy with people to talk about abortion in an open and honest way. And I think some of that may be due to this polarization that we have, that people are afraid to share information or share their stories. But it is so important, because that stigma is just kind of keeps everything in the dark and keeps us from really talking about putting a face on things and putting the reality to it. A stat that Elisabeth Estrada, you and I spoke about, was the fact that 60% of women seeking abortions are actually parents,
Right.
already. And so again, I don't think people have the right necessarily picture in their mind when they think of who is accessing this medical care. I just want to touch on that a little bit, because we have seen the ways recently with, you might say with Me Too, and you might say also with Black Lives Matter, we've seen how these large movements and calls for action have started to create a shift in public opinion. There's still more to be done, but you have seen the needle move. And so I wanted to hear a little bit more from both of you about how we might go further in moving that needle on this issue and making sure that people can talk about this. How do we change this conversation?
Well, if I may, I like that you brought up, and forgive me, I definitely wanted to bring that into the conversation, because like you said previously, based on polling of, American women, the stats are like close to 70% that Roe should not be overturned. And that includes, or rather is reflected in the Latinx community, where we did polling in 2016, similarly at the same rates. And that includes what would be otherwise looked at as a conservative, cohort of Catholic Latinx people. Similarly, support women's access without the interference of politicians. So I think that reminding people that they have this connection to others, I think what you keep, we're talking about healthcare access, and we're talking about this current moment of this pandemic. What I have been noticing is, and what is being reminded, or hopefully we take this lesson that we are interconnected. We need each other. We need one another. Science tells us that we cannot make it alone, that we have to be in the company of others. That is one of the things that is shifting the culture. So we have this need, and now we're being reflected that the need is not only in our minds. It's not us being needy. It's not us being, going against the culture, but rather demonstrating how all along we've needed each other. That's why I think coming into spaces, with non-Black folks, or, non-immigrant people and my white allies is really important, because I always talk about how we're interconnected and we can't do it without each other. And that, I think, is where it gets to that culture shift, where we can talk about stats, we can talk about percentages, but when we hear people's stories that are across cultures, that are across race, nationality, it is when we are able to open up a door that otherwise has stayed closed because of shame, because of embarrassment, because of stigma, especially around abortion. So I just wanted to kind of illuminate that Latinas, white women, and Black women often look at a woman's right to decide in the same way. And the fact that we're already parents when we decide to have abortions really breaks the stigma of this idea that it's, an irresponsible person out there just not making, it's like a Tuesday and I'm going to go have an abortion. Nobody, and even if it was that way, it's none of your damn business is what I like to say. Like, that's part of the culture shift. That's one of the activists in our training said, I'm really pro mind your damn business. And I'm like, yes, I love it, because it's not, it's not adhering to our talking points, but it's what people feel. It's what people think. And so if we open the doors to someone's, living room, and they invite us in and we talk over coffee and they tell us that, then we're affirmed what we already knew through the numbers, that everyday people support this.
Mm-hmm. And when you were talking, it just really reminded me of this concept that, it's unfortunate that abortion gets pushed over as like this other thing. it is part of a continuum of reproductive health care. And personally, as someone who's been pregnant and has a daughter, I've seen the way that this is part of a continuum of that care. And you can't break one away from the other. And it's a holistic part of the span of a person's life. Any person that can become pregnant, this is a part of their lifespan and their decision making and their access to the medical care that they need. And it's terrifying to be pregnant and not know what could happen and be in a place where you might not be able to access that care. And then to take on that point of the none of your damn business, which I liked. Elisabeth Smith, we were kind of talking about, just this idea of like this framing that it's like, oh, this is a quote unquote tragic choice, or that often comes up. And I think that's another way of shifting things, right? To talk about it as an empowered decision, or a decision that needs to be there as part of the continuum of healthcare. I didn't know if you had any more to add to that.
Yeah, I just, on this question of how do we get rid of abortion stigma, I want to pick up one thing that Elisabeth said, and tell a good story from the elections. So many of you may know that in Colorado there was a ballot initiative, and it was a 22-week ban, and it was defeated, which is great news. And the vote was overwhelming. I think it was almost 60% of folks in Colorado voted against this ban. And Colorado is a state that has a very large Latinx population and a white population. And when we talk about abortion, there are less people who say, oh no, as Elisabeth said, you can't talk to Latinx people about abortion. And organizations like Coulor in Colorado said, no, absolutely, we have to talk to our fellow Latinx people about abortion. And guess what? They voted overwhelmingly against the ban. That community was, some of the most ardent opposition to the ban, which is great. So again, not predetermining who supports reproductive rights and who doesn't is a big step. I also wanted to say, I phone banked for the Colorado campaign against the ballot initiative, and I made a phone call to a woman, and I started the talking points, I started the spiel, and she stopped me and she said, I had an abortion at 7 months, and this ban is the worst thing that could happen. And then she told me about her story, and she told me about how she worked with her husband and her pastor and her prayer group. And her pastor said to her, Julie, Jesus would make this decision with you. You're making the right decision for your child and for your family. And I have chills talking about it now. But while I was on that phone call, I just felt like I was being given a gift to hear her story. And I think, again, we tend to think, oh, if you're religious, you don't support religious rights, or if you're this, or if you're that. But the more that we have conversations with each other and the more that we learn each other's stories, all of those walls just get exploded. Mm-hmm. And, Jean's heard me say this, when I'm in, not now, obviously pre-pandemic, when I was in a lift or an elevator or talking to people and like, what do you do for work comes up, I always say what I do. And I have conversations. And I have to tell you, the vast majority of those conversations have been positive, even when we disagree. So I think just telling people that you support abortion rights, having a conversation with people. And then again, I think someone in the chat said this, we're talking about abortion right now, but we need to be talking about everything else. We need to be talking about reproductive justice. We need to be talking about intersectionality. And so I would just urge everybody listening and who's part of this conversation to really talk to their friends and family and talk to strangers, right? Like, it's not as easy to do that now, but the pandemic will be over at some point, and we can be, maskless walking on the streets again, and we can have a lot of conversations that are powerful and that will change minds.
Yeah, that's such an important and powerful point, that we can't let our own assumptions and that we make about others, putting people in these different political categories, stop us from having real conversations. I think that's an important takeaway. We only have about 5 minutes left, so or less than that. So what I wanted to end with, though, is I wanted to give each of you a chance to talk about what's the most important thing we can do, because as we know, New York State, we're very proud that we were a part of passing the Reproductive Health Act last year. So we have codified Roe into our New York State law. We do have state Medicaid funding for abortion. I mean, of course, there's always more work to be done in terms of access, as you mentioned, Elisabeth, Estrada, about there's more crisis pregnancy centers, fake clinics than there are real clinics. But at the same time, compared to the rest of the country, we're in a really strong position. And also last year, New York City became the first place to secure a publicly funded abortion fund. And so there's a lot of good work that's happening here. So we have a whole phone, a whole group here from New York wanting to know, how can we help our allies in other states? How can we push this forward? How can we remain sort of the beacon for the rest of the country in some ways? So I'd love for both of you to just end on that note of how we can take action.
Well, I love what Elisabeth said about we need to be talking about more. I do think that, in reproductive health rights and justice, because it's such a contentious issue on abortion and it's constantly attacked, that we focus on that. And it's not bad, but it is, like Jean said, a full spectrum of reproductive health decisions. I work mostly in the Bronx. That's where I live. That's where I'm calling in from. And you see here that there is a really huge lack of doulas. There's a really huge lack of birth workers, and that people are not getting the care during pregnancy, after pregnancy. We see postpartum issues be a huge problem, with even death after. And then, of course, the maternal mortality rates in this country. So I love the idea of talking about reproductive justice in the full spectrum of care. That will open doors for us to get rid of the shame around trying to access an abortion and accidentally being lured into a CPC, or a fake clinic. Because oftentimes those are the most painful stories, when you intend to terminate a pregnancy and are forced to become pregnant. And that's what CPCs are doing. They're forcing people to carry their pregnancies. And they're not really helping anything after that. So I think that the full spectrum of care is the direction that in which I need to go in, because I know that that opens up the doorway to talk about all of the experiences that as parents we will, confront in our lives.
Thank you. Thank you. Elisabeth Smith, do you have anything to add to?
Yeah, I think we saw a good change this week in New York. The Commission on Human Rights did an investigation into drug testing of people at hospitals in labor and delivery. And that's a good step forward, because the question of the child welfare system and what happens to people in the midst of becoming parents based on their identity, and as we talked about, assumptions that healthcare workers are making about them. Again, I think going back to this piece on intersectionality, we need to make sure that everyone in New York City and in our state can actually make decisions for themselves about whether to terminate a pregnancy, whether to become a parent, and how that parenting happens, right? So the great news about not doing random testing of people in labor and delivery and postpartum is wonderful, but it wasn't coupled with, we're not going to do random testing of newborns in the hospital, right? Because that happens too. So I think we need to continue to look at all of the various policies that affect everyone in our community, but most especially Black and Brown community members, Indigenous community members, and how their reproductive rights, health and justice decisions and the assumptions we make about them either, help or hinder their ability to live full lives and make reproductive decisions and have reproductive autonomy. So I think we should feel great that we're in a much better position than some of our friends and family in other states, but we never should rest on our laurels. There is so much work to be done, more conversations to be had. And I would just urge everybody on the call to just think about these things and think how they could plug in and what organizations they could reach out to try to start having conversations and making some change.
Yes, thank you. And I think that's what we see as we've expanded the fight to reproductive justice, which really is looking at, in a more holistic way, in particular, access for women of color, the gap in, healthcare access for women of color, the healthcare disparities, but then also the continuum of care, just not only healthcare, but also the rights to parent in safe and sustainable communities as well. And so it's a bigger, we've expanded it, but by working on all those fronts, I think both of you have really made a compelling case for how we can make change, even here in New York. So I just want to thank both of you for this really insightful discussion and for bringing your expertise. That's the Center for, Elisabeth Smith from the Center for Reproductive Rights and Elisabeth Estrada from the National Latina Institute for Reproductive Justice in New York, and both organizations as well as now that you should be looking at to support moving this work forward. So I thank you so much.
Thank you, Jean. Thanks.